All right, ladies and gentlemen, this is going to be our bleeding control shock management skill station. For this skill, they're going to give you a little spiel. They should tell you where your bleed's going to be coming from prior to you actually starting your scenario. The main thing you're going to need to do is control this bleed in this scenario. Once you've got that bleed controlled, your examiner should instruct you that your patient's showing signs of symptoms of shock, and then you should initiate your shock management and transport immediately. So for this skill, pretty simple. We need our tourniquet, we need our PPE, which for a skill like this, if there's a severe amount of blood, we might want to fully deck out, but we for sure need some kind of safety glass protection and gloves, all right? And it might not hurt to have a face shield, because if you're dealing with squirting blood, it's an arterial bleed, it could potentially get in your face. You're also going to need O2, which I have at the top of the head of the stretcher up here, and a blanket as well for your shock management. So at this time, we'll go ahead and start. We're going to have to do our PPE, BSI, whatever you want to call it, gloves, safety glasses, face shield. We're going to say that this patient has a severe right forearm bleed, laceration, severe bleeding, arterial bleed. At this time, we're going to go ahead and put direct pressure on it. Our examiner should note that our bleeding is not controlled at this time. So we're going to take our tourniquet. We're going to go ahead and place our tourniquet in place while still maintaining direct pressure. At this time, we're going to continue to tighten the tourniquet until the bleeding stops. Once that bleeding has ceased and stopped, at this time, we would go ahead, our examiner is going to say, your patient's showing signs and symptoms of shock, so we're going to initiate our shock treatment, which would be laying our patient in the supine position, covering them with our blanket, and placing them on high flow oxygen at 15 liters via non-rebreather mask, and then we're going to transport to the hospital immediately. At this time, I'd be done with this station. One key thing you want to note when you're doing this though, before you get started, check your equipment. Know what types of tourniquets you're using, because there are various different types of them out there. So you'll need to keep that in mind. And then should be a pretty simple station for you. Hopefully you'll get it done at National Registry. It won't be no problem. Thank you for watching this video.